Welcome to this special episode of AU Manufacturing Conversations, which is part of our annual Australia's 50 Most Innovative Manufacturers campaign. This time around, the 50 Most Innovative has been made possible through the support of these wonderful sponsors: Australia Wide Engineering Recruitment, TXM Lean Solutions, the Industry Capability Network, Bonfiglioli Australia, the Advanced Manufacturing Growth Centre, and the SmartCrete CRC. If you're interested in nominating, please see a link in the episode details. It's completely free to be a part of this campaign and always will be, and we'll be celebrating the announcement of the 50 Most Innovative list and the award winners at a special breakfast event on May 7 at Crown Melbourne during Australian Manufacturing Week. Now on with the show. Mark, thank you very much for joining us on AU Manufacturing Conversations. It's a pleasure to have you on the program.
Pleased to be talking with you, Brent.
So we'll get started in standard fashion, and that's with the standard opener, and that is, how did you get here and what do you make?
So a convoluted journey over many years. So 27-year journey that I'll try to compress in a sentence or two. I started my professional life finishing my PhD in rockets, became an accidental biomedical engineer over at Oxford, discovered my passion in that space there, inventing technologies for global healthcare. That really resonates with me. And over the last 27 years, I've been practicing in that space. And the three distinct chapters in that journey: the first, co-creating a real-life Star Trek needle, if you like. That's called a Jing gun. And the second being inventing a needle-free vaccine delivery patch and taking that forward. And the third being now creating our micro-wearable technology for personalised health. And I think by and large, investors have tended to be happy with the things I've helped on. It's generated about $2 billion of value so far for investors, and invention comes more naturally to me than most people. So about 160 inventions at this point in time as patents. But my guiding purpose in all of this is using my skill sets to be put to useful activities for making a difference in global healthcare. So that's my high-level summary on that. And what do I make? What I'm making right now here at WearOptimo, my team are making it. There's very much a royal we associated with this, that's for sure, is next-generation wearable technologies for personalised medicine. We call it a micro-wearable technology. And the tip of the spear for that, bad analogy, but the thing that interfaces with the skin is a micro-electrode array. And we have an advanced manufacturing facility that's up and running and working already to help make that happen.
Excellent. So I promise this is not an interview about Vaxxas, and I realise that, not that I can sense you being irritated or anything, but I understand that sometimes when people have moved on to a new project, they can get a little tetchy if you keep bringing up the old thing that they're no longer a part of. But I just have a couple of questions regarding Vaxxas because they're quite well known to our audience. Obviously, we've been following their progress, and Angus Foster is a previous guest on this podcast and a friendly acquaintance. So we know and love Vaxxas. I just wanted to ask, what did the gap look like between you leaving Vaxxas in what I think is 2015 or 16 or thereabouts and starting WearOptimo?
So I stepped out of Vaxxas in 2015 and did a sabbatical over at Harvard and worked with the founder of Moderna, Bob Langer, there. Around that time, the Apple Watch came out and the earliest versions of that, and I could immediately see the inherent limitations of that light-based approach in the skin's barrier function. And as a founder of the field of microneedles, I could see immediately the opportunity for gaining access to signals to be part of that next generation of wearables, to gain access to signals that matter the most. So the foundational thinking kicked in pretty quickly on that. That led to WearOptimo being founded in earnest with the backing of the Australian National University in 2018.
I promise it's the last Vaxxas-related question. I'd like to know some sort of, because obviously they're different companies doing different things. They have the, I guess, similarity in that you founded them and they, roughly speaking, to do with stuff just under the skin. But I think we might benefit, we as in listeners, from a little explanation about how things were different, putting the two companies together and getting them up and running.
Massively different, actually. So first invented the nano patch in 2004. I was when the first patent filing kicked off then. Founded Vaxxas in 2011. That was off the back of the research I was doing and leading at the University of Queensland and my research group there. and the influence I had from my Oxford mentors, seeing the way they did that. So to me, it was automatic to set about building a company because I've been part of that over at Oxford. So I didn't even think twice about that, and I knew that was the vehicle that was needed in going forward. I deliberately set up Vaxxas in Australia and went against the trend of sending it offshore as well, and set about creating that funding and taking that forward there. So that was that particular journey. And so the technology, I'll come on to the formation of WearOptimo and the differences there, but from a technology point of view, massively different. So I created the nano patch for needle-free vaccine delivery. So with thousands of tiny projections using a probability-based analysis and it needing to be applied to the skin quite quickly as dynamic application, and invent ways to coat the vaccine and invent ways to release it, and multiple different patterns tied in with that to make it all work. So the concept is straightforward, but there's some layers of complexity underneath that. And that's designed for, of course, thermostability and reduced amounts of vaccine that's required, and being needle-free as well. And so I'm quite comfortable with talking about that, Brent. It's something that I've created, so that's fine. And I wish Vaxxas all the best. And of course, I'm a shareholder in that activity. But stepping out from that, the differences with WearOptimo, so it's the next generation stealth-like wearable. So instead of having thousands of projections coding vaccines, just a handful of much smaller micro-electrodes going even shallower into the skin that are just gently applied to the skin instead of at high speed. And for a totally different purpose. So it's very stealth-like. The sensation generally feels like a sticker. And what it does is completely different purpose. It's for continuous monitoring of hydration as one example, and detecting other biomarkers. So I think something that have a bit of a fluidity of mind to not be a one-trick pony, I suppose you could say. So prior to the needle-free vaccine delivery patch, I was co-creating a handheld rocket that fired vaccines into the skin at 1,500 miles an hour. So making the leap from that to a patch was quite a leap. And then making the leap from the vaccine delivery patch to a micro-wearable was another quite a distal leap as well. So I think I probably addressed that from a technology point of view, Brent, unless there's any other questions on that.
I think that covers it. I just might like to know further than that. One company was university spinout, and the other looks like you came up with the idea, you've worked with the university and ANU as a foundational shareholder, but you're not taking technology out of a university, as I understand it. Was there a different sort of thinking required from, okay, here's a research program, this is the path forward, these are some of the challenges we need to address, and having to move at a different cadence in a private business and figuring things out in that fashion? Are there any major differences between the two exercises you think are worth mentioning?
Absolutely. So the needle-free vaccine delivery patch is part of the biotech world, which is competitive, but it's a process that takes multiple years from idea to product. So good colleague, friend and mentor of mine is Ian Fraser, and Ian's story of Gardasil is well known, but it's worth retelling, of course, because it's an amazing success story from idea to product with Gardasil, and it was a 17-year ride, though, for that. Now, that's biotech. So when I set about creating the vision for WearOptimo, I could suddenly see that this is the world of Healthtech. And Healthtech is a much higher tempo game compared to biotech for a multitude of reasons. A more nuanced approach with regulatory. There's very few biologics that you need to consider, perhaps none. And culturally, its center of mass is coming out of the likes of Silicon Valley as opposed to traditional pharmaceutical companies. So you need to move quickly and at speed. So off the back of that, I knew that to realize this vision, it wasn't going to be viable to do it in a university context. It was going to be too slow. By the time you spin out a company, the ship has set sail. So I knew that. And what was remarkable is the ANU agreed and accepted that. And so we created a completely new model. And that allowed me to create, with the ANU's support as the foundational investor, a private company from the get-go. The ANU backed substantially without needing to be tied up in a university context. So we could just get going with it and do it quickly and be extremely streamlined and be focused. And that created a fit-for-purpose vehicle. And it's been a great situation. And it's really set us up very nicely as a business going forward.
I was wondering if you could please expand on how the micro-wearables work and what signals they're able to pick up and interpret.
Yes, so the skin's an amazing organ, Brent, and it does a fantastic job at keeping the good stuff out. Sorry, the good stuff in, the bad stuff out, the other way around. And so it's a barrier. But it's a barrier for everything, so that includes pathogens, but it also, if you're trying to gain access to signals, if you're putting something on the surface of the skin, there's very few signals you can gain access to. Apple Watches and today's traditional surface-based wearables are entirely limited by that barrier function with what they're achieving by using light. So we identified this and created microelectrodes that just reach into this outer layer of the skin, as one example, the viable epidermis. And that then opens up this rich array of biosignals that you can otherwise not reach, and in areas that matter a lot. So that's a high-level summary of how it works. Now, if we talk about our very first product, which is the product range, which is in the area of hydration, is that we've identified that the most sensitive part of the body to changes of hydration is this layer of the skin. It's the viable epidermis of the skin. So as we dehydrate, other parts of the body do not change much or change slowly. The skin changes really, really rapidly in terms of hydration. The reason why is that it's a water tank, if you like, that strips fluid from there and sends it to your blood. So it's a very massive change. So by us interrogating that with these microelectrodes and doing bioimpedance sweeps, we get ultra-high fidelity, rapidly changing signals uniquely that others just are unable to achieve. And we have our own in-house developed artificial intelligence approach, machine learning, that reads these signals and gives you a direct readout of hydration, how hydrated you are. And so if I roll all of that up, WearOptimo is positioned as the only wearable, our technology is the only wearable on the planet that genuinely monitors hydration. There's others out there that say they do, but they're not working effectively because they're quite limited for a whole bunch of different reasons, like sweat approaches are not correlated with hydration, as one example. And the unmet need is massive. So we're talking about $22 billion total addressable markets. We're talking about half the things that go wrong for people in aged care are directly attributed to poorly managed hydration, just as one example. We're talking about if you're only 3% dehydrated, it has the equivalent effect on your brain function as being over the blood alcohol limit. And that means it plays out in so many different domains. As one example, if you're in the resources sector, as a bit of a rough analysis, high-level summary, if you're an outdoors worker exposed to heat and that external environment, the upshot is it could be affecting productivity of those operations by about 10% because of the poorly managed hydration. That's massive. It's quite similar in the military as well. So that's from a commercial point of view, but of course, there's the health perspective, workplace health and safety, reduce risks of incidents. And there's also improved performance as well in terms of elite athletes, minimize injuries and maintaining working at the highest level. So there's so many different areas, and I've answered your question probably beyond what you'd originally intended. So I'll stop there.
A long and explanatory answer is not a bad thing. The next thing I'd like to ask about, recently you announced that you've commissioned the first stage of your factory in Brisbane, and understandably our audience is interested in production. Could you tell me a few things about how these sensors are made, please?
The centrepiece technique, Brent, in our advanced manufacturing facility is a technique called Nano-imprint lithography. And in our building, it's set up and is commissioned, and it's already producing first batch micro-wearable sensor chips. And an interesting story, I think, for your audience, because it's another example of one of the mojos of our business, which is field hopping. So spotting something from a really different field and thinking, oh, that can make an amazing impact in this field. And so nano-imprint lithography is primarily used in really different areas. So it's flat screen TVs and optics, OLED TV screens, the likes of Samsung, etc. The genius, and I don't take credit for it, it's others in my team, my CTO, Dr. Anthony Brewer, Dr. Vignesh Suresh and others. They spotted this technique and thought, hang on, it can be brought across into this field to make our micro-wearable sensor chips out of polymer, at volume, at low unit cost as well. A massive step change. So we set about doing that. pleased to receive, in the context of the pandemic, the push for sovereign capability, pleased to receive the support from the federal government as well as the Queensland government through grants. And that allowed us to purchase this equipment and use it uniquely. It's the first time, to our knowledge, on the planet that any form of health application is being used with nano-imprint lithography, firstly. But second is it's the only substantive nano-imprint lithography equipment in the Southern Hemisphere, let alone Australia. And it is genuine advanced manufacturing equipment. It's 8.5 tons of dedicated equipment from the Netherlands. And Brent, what it allows us to do is produce up to about 30 million micro-wearable sensor chips per year at a very low unit cost and made of polymer. And what also excites me about this is a founder of the field of microneedles. I've been at it in the field for more than 20 years now. It's a step change for the whole field. So manufacturing's been one of those things that the field's been grappling with in different domains, different technologies, different companies. And this is a leap forward in the whole field. And so we're very excited about that. So I think it's a genuine contribution, not only within WearOptimo, but also globally.
This is a short interlude to again thank the sponsors that are making 2025's 50 Most Innovative campaign possible. Our appreciation goes out to these legends: Australia Wide Engineering Recruitment, TXM Lean Solutions, the Industry Capability Network, Bonfiglioli Australia, the Advanced Manufacturing Growth Centre, and the SmartCrete CRC. Now back to the show. You mentioned just then the move towards emphasising sovereign capability. Tell me from your point of view what it looked like shifting from what I read was an original decision to get these sensors made overseas, going from that to deciding, okay, no, Brisbane's the place for it and we want to have control over that supply chain, or whatever other reasoning went into it. Could you tell me something about that for context sake, please?
You know how this goes. In running a business, you look at things, there's different perspectives. So you can look at it from a balance sheet point of view, you can look at it from a point of view of technology, IP control, team dynamics, R&D, culture, all of those things you consider. So from a kind of financial point of view, you think, well, prior to the pandemic, the way to go about this was tap into an existing facility and set up a contract to have small unit runs done, working with them up at somewhere else and doing it as a collaborator potentially. That's a model that, in terms of a CapEx point of view, is advantageous. But by the same token, on the other side of the ledger is you're a small job among many jobs. So there's that to consider. And then on top of that, culturally, you're just a job. Well, if it's in-house and it's an extension of the R&D unit and the team and people that are brought into the business and care about the technology, it's just another level. So that's something that was a model that we were prepared to do before the pandemic. Then the pandemic happened. No one wanted it, of course. Everything changed. The option of doing it offshore just couldn't even exist, even if we wanted to do it. And we couldn't even travel, all of those things that we tend to want to forget about the pandemic, but it was real. And so what happened next is that push for sovereign capability came about. And I'm glad it did, because it really aligns with my core as an engineer, where it brought in-house that extension of our R&D, which is the capability of how to do the production as well, brought in the control on that. And it was great that we had the support of government to help take the edge off the CapEx side of that. But now we have a one-stop shop. So here within the building, we create our own patents. We, at the same time, have been servicing our clinical trials, which have been successful. But on top of that, the other component to the team is the advanced manufacturing and the process development for that, where we're creating and developing our own IP and controlling that, keeping in our own control that important fundamental working unit physically that is completely new. Now, there's other parts to the tech that we assemble, which is electronics. There's some novelty in that, of course, but there's one bit that's fundamentally new. And so, yeah, of course, no one wanted the pandemic, but it's a significant silver lining for us here at WearOptimo that we have that in-house.
So we've covered how these are made, the sort of volumes you hope to get up to of 30 million if needed per year, the problem you're addressing. I'd like to know about the business model. Obviously, you've got all those things we just mentioned in mind. But how are you going to monetize it and make sure this is a growing, viable, long-lived business?
It's a platform technology, Brett. And so part of the art that comes with that is selecting what your first market is and how you address that market in the most effective way. And while our platform is deployable in many, many different markets and areas, like, for instance, down the line, continuous monitoring of troponin for the detection of a heart attack, which is massive, we need to walk before we run. And hydration is still a massive area of unmet need, but also it's a minimum viable product. So simplest embodiment of our technology. And on top of that, a non-regulated pathway in the first instance in many territories and many markets. So it's our most streamlined route to sales. And so we begin with elite sports. And so we begin there because a great way to think about elite athletes is that they're like a Formula One engine. They push their body through limits that others would not readily do. And so there's an amazing dynamic range of data that those individuals generate, but also massive beneficiaries as well. Their first cab off the rank, gaining access to this advanced technology to perform as an elite athlete. So we begin in selected areas of elite sports, and that allows us to do what I call the high impact, low volume work as we're getting in place and spooling up our manufacturing. And with the manufacturing online, then we roll out to our first volume markets. And we have a distribution deal with Biomedical, which is the world's second biggest provider for emergency and health services in the mining sector as well as in the military. So we have that established channel, and then we'll go through those markets for sales. Now, the way that we'll be approaching those sales is very much along the lines of a subscription approach. So as one example, in the mining situation, there'll be servicing on a one miner per year basis, and the sensors are for that individual and the other things that they need in that context.
Mm-hmm. The next thing I'm curious about is the regulatory hurdles you have to go through. You said it was non-regulated, but I imagine you have to validate things in some way just to make sure that everyone knows it does what it says on the tin. Tell me about some of that stuff, please.
So here in Australia, just as one example among many, there's the regulatory advice that we do not need regulatory approval for our first markets. So the ones that I've referred to, so take elite sports, the mining sector, and also the military. Further down the line for hydration, as you get into hospital settings, I think that becomes more nuanced and it starts steering towards a regulated product. So our product development pathway right now is we have in place that pathway towards a regulated product ultimately, but we've configured it so that we can pick it off and go to the non-regulated markets in the first instance. So that allows us to be streamlined. But whether it's regulated or not, you still need to demonstrate that it works. There's a burden of proof on that, and that it has the reliability, and you're still working to the appropriate standards, etc. A good, simple way of thinking about it is how you position the burden of proof. So the burden of proof from a regulated product, it sits primarily with the regulators to dictate that. When you're in the non-regulated space, that sits with you and your business and your nuanced judgment on how you go about that. So you still have a burden of proof, it's just done in a different way. And dare I say, it's a bit more streamlined when you're not needing to do that initial dance with the regulatory authorities.
In line with our current Australia's 50 Most Innovative Manufacturers campaign, we're speaking to a lot of companies on that subject, and obviously you're well respected as an innovator on a personal level. I was wondering if I could get your point of view, please, on what makes a company innovative. Are there things that you would say define a company that is innovative versus one that isn't?
I think a good starting point is if you're doing something that's never been done before, but if you achieve that, it has a significant impact. So start with that, and then you can unpack that in many different ways. Then next level down is how you go about it. There's innovations in how you go about it as well. I think if you're doing something that's incremental and it's already been done and you're refining and tweaking something, I don't think it's that innovative. I remember my days in aerospace, I had colleagues working over at Rolls-Royce on the jet engines, jet turbines. They're working on squeezing out 0.25% efficiency gain here and there. And in their world, that's significant. To my world, it didn't sound exciting at all. It was in the incremental bucket, right? So I'm interested in step changes and making them stick and doing it in a way that actually addresses something with significant impact. If you're doing something that hasn't been done before, there might even be a non-obvious component. So I hadn't thought of that kind of assessment. I hadn't really thought of that idea. How did that come about? Now, I'm sure there's many other ways you can answer that, but a good starting point is not being a me too and doing something different. Now, there's everything that comes with that. So quite often it makes it a bit of a harder journey as well. When you're right on the edge of the fusion of tech and science at the same time, it's not a game for the faint-hearted. And I would say when people ask what's it like doing this, you could be in academia having from the outside looking in, a simpler life, almost a cruisier life, if you like. And the answer is, well, for me, it's an extreme sport is the best analogy I can give. And it chooses you as much as you choose it. It's a bit of a calling. But if you want to do it, then you need to be an extreme athlete as well. You need to be able to handle it.
Sure. I don't doubt that there's a huge amount of stress involved. Lastly, the closing question for this podcast is always, what's an issue within manufacturing that isn't getting the attention it deserves? I speak to lots of people from lots of companies and lots of different roles, and everyone brings their own perspective, and I really like that it's a kind of not a Rorschach test, but it says something about what the individual is thinking about, what their business is concerned with, etc., etc. So I'd like to get your point of view, please, on an issue within manufacturing that's currently not getting the attention it deserves from, the media, policymakers, the public. Take your pick.
I can imagine a lot of parties will talk about the level of support or funding that's given the diminishing macro picture of manufacturing in Australia over the years. I can imagine that's one that people talk about. I would, and I've said it, I'll steer clear of that. And because I think a lot of people would have said that, I think an interesting area is how we go about genuine advanced manufacturing positioned on the world stage. We can't compete at everything. Okay. So I think we need to choose carefully the areas that we genuinely want to be the world's best at and go after that in a very focused, discrete way. And I think we need to be cautious about Me Too manufacturing. So we need to be cautious. I don't know what a good example is. I suppose solar. If solar's done at scale elsewhere, and we're effectively just doing the same thing, we're just doing some local manufacturing on that. I can see some arguments for why we need to do that, but I'm not convinced that's the tip of the spear for the narrative of genuine advanced manufacturing.
Yeah, well, I mean, you can't win every battle, and the battle that involves undifferentiated, high-volume products is probably not one that an Australian company is going to do very well at, for obvious reasons.
But may I ask the question to you? What's the typical answer you get for that question?
Yeah, sure. We tend to get a lot of responses around the availability of skills, especially for high-tech, newer companies. I mean, everyone for the longest time has had general skills issues. Australia, as a rule, has not produced enough engineers out of universities to begin with, but further than that, the number of big industrial companies in Australia and accordingly the number of people coming out of them with real-world proper manufacturing experience is pretty limited, though there are examples. That's an obvious one. I guess energy also for the longest time has been something that's a bugbear for a lot of companies, especially ones that require a lot of it for processing or whatever other purpose. So yeah, those are probably the two most common. There are others, but I'm not thinking of them right now. So that's my answer.
I see that. I certainly see the energy one's interesting. Hadn't given that much thought, but I get it listening to you. The skills side of it, for sure, more streamlined ways of the flow of international talent, I think can really help on that front as well.
I imagine you've had to look overseas for a lot of the smart cookies in your team.
Oh, I tend to. It's a bit like a sporting team. We have our kind of grow your own, and we have your pathways, if you like. So we have it right from the base level of interns doing their undergraduate degrees, but right up to top level where it's people with serious industry experience and PhDs, and it's open slather of where they come from. So I have a combination of people that are grown within the business and also just from within Australia, but also international people as well. And I tend to try and do that as much as I can. One of the things that we are doing is providing really unique and valuable experience to people within the business. And we do set the bar very high on who comes in to the business as quite a big selection threshold. But what comes with that is once you're in the business, we assume you're good at what you do and we treat you that way. And we give you opportunities well in advance of what you might otherwise get at this stage in your career. People only 1 or 2 years out from their engineering degree are seriously contributing on running clinical trials as one example. And the reason why I do that is I feel a sense of gratitude to the type of version of that I had in Oxford, my innovation apprenticeship there. And my thinking is, rather than needing to go to a place like Oxford, which of course I love and I've got no problem with going there, but it's providing those sorts of innovation apprenticeships here. So you learn the art of how to go about doing this. So down the line, people that have worked in WearOptimo are creating businesses like this in their own right in Australia.
Cool. Okay, well, I believe that's everything we have time for. So thanks for coming on AU Manufacturing Conversations and discussing extreme sports with us. It's been fun.
Yeah, thank you, Brent. Really appreciate it.